The radio crackles at 11:47 p.m. Motor vehicle collision, Highway 9, multiple victims, possible entrapment. You throw the ambulance into drive and hit the lights. The siren splits the night open. Your partner is already pulling on gloves in the passenger seat. Neither of you says a word. You pull up, and the scene is worse than dispatch made it sound. It always is. 2 cars. One flipped on its roof, gas leaking, a teenager's arm hanging out of the shattered window. The other car is wrapped around a concrete barrier like aluminum foil. A woman is screaming somewhere you can't see yet, red and blue lights everywhere. You grab your bag, 40 pounds of equipment, drugs, airways, monitors, bandages, IV kits. You run toward the screaming, not away from it, toward it. Because that's what a paramedic does. You're not the ambulance driver. You're not the guy who just shows up and puts people on stretchers. You're the one kneeling in a pool of someone else's blood at midnight, making medical decisions in 60 seconds that surgeons make in 6 hours. With no lab results, no x-rays, no backup, and no second chances. If you get it wrong, they die in the back of your truck and you drive the rest of the way in silence. Welcome to your life. You didn't plan this. Nobody grows up dreaming of starting IVs in the rain on the side of the highway. You were probably an EMT first. Maybe you rode along on an ambulance because you needed a job and the AD said no experience necessary. 6 months of EMT school, 150 hours of classroom time. Then you saw what EMTs actually do. You realized the EMT can keep someone alive. The paramedic can bring them back. You wanted more. Paramedic training, 1,200 hours minimum. Some programs run 18 months, some run 2 years. You're learning pharmacology, cardiology, advanced airway management, trauma assessment, obstetric emergencies, pediatric emergencies, toxicology, and about 400 other ways a human body can try to die on you. Clinical rotations. You're in the ER, the ICU, the OR, the labor and delivery ward. You watch a surgeon crack a chest open. You watch a baby come out blue and silent. You watch a cardiac arrest from start to finish and realize that the thing they do on TV where the patient coughs and wakes up is a lie. Real CPR breaks ribs. Real CPR lasts 45 minutes. Real CPR usually ends with a doctor saying time of death while you stand there with sweat running down your spine. The NREMT exam, National Registry of Emergency Medical Technicians. Your entire future depends on a computer test. You either pass or you don't. There is no almost. The median salary waiting for you on the other side, $58,410 a year, $28 an hour. A plumber makes more, an electrician makes more. The Uber driver who takes you home after a 6-hour shift might make more. You just spent 2 years learning to restart a human heart, and you'll make less than a dental hygienist. But you passed. You got the patch. Paramedic. Congratulations. Now go kneel in someone's blood for a living. Your office is the back of an ambulance. 8 feet by 10 feet of controlled chaos. A cardiac monitor. A drug box with enough medication to kill or save a person depending on the dose. You and your partner. That's it. 2 people against whatever walks, crawls, falls, or crashes through the 911 system tonight. No doctor standing behind you, no nurse handing you instruments, no hospital walls around you, just a metal box on wheels and whatever you brought with you. 12-hour shifts, sometimes 24. Some systems run 48 on, 96 off. You clock in knowing you won't sleep and you probably won't eat a hot meal. The average paramedic runs 8 to 15 calls per 12-hour shift in a busy urban system. That's a new crisis every 45 minutes. Some nights it's back to back to back with no break in between. You eat a protein bar while driving to the next call. You pee at gas stations between runs. The smell of the ambulance, disinfectant, sweat, old blood, and fear. It never fully comes out. You spray and wipe and sanitize after every call, but the truck remembers everything. Every overdose, every cardiac arrest, every person who died on that stretcher. Your uniform costs you money. Most departments give you 2 sets. 2. You work 5 or 6 days a week. You buy your own boots, your own stethoscope, your own trauma shears. The department that pays you $28 an hour expects you to subsidize your own equipment. The chest pain. 62-year-old male, crushing substernal pressure radiating to the left arm, textbook heart attack. You're running a 1-2 lead EKG in the back of a moving ambulance while your partner drives like a maniac through intersections. The tracing shows ST elevation. STEMI, the widowmaker. This man's main coronary artery is closing like a fist. You need to get him to a cath lab in under 90 minutes or he's dead. You push aspirin, nitroglycerin, start a line, hang a heparin drip, you radio the hospital. Every word matters. Every second matters. You are this man's entire medical team right now. The overdose. Back alley behind a gas station. A 23-year-old face down on concrete. Needle still in his arm. He's not breathing. His lips are blue. You push Narcan into his nose. 30 seconds. Nothing. You push another dose. His chest heaves. He gasps. His eyes fly open, and the first thing he does is try to punch you. He's angry you saved him. You wrestle him onto the stretcher. He calls you every name in the dictionary. You'll see him again next week. Maybe tomorrow. You'll save him again until the day you pull up and he's cold. The trauma. Motorcycle versus SUV. The rider is in a ditch 30 feet from his bike. His helmet is cracked. His femur is sticking through his jeans. That's an open fracture. The bone is in the air. You stabilize the leg with a traction splint while he screams things about your mother that would make a sailor blush. His blood pressure is dropping, internal bleeding. You start 2 large bore IVs, push fluids, and drive. The helicopter is 15 minutes out. The hospital is 20. You don't have 35 minutes. You have maybe 10. So you drive and you squeeze the IV bag with your fist to push fluid faster, and you talk to him. You keep talking because if he's answering, he's conscious, and if he's conscious, he's alive. The pediatric call. The one every paramedic dreads. You walk into an apartment and a mother is holding a baby that isn't moving. The baby is 6 months old. You take the baby from her arms and it weighs nothing. Like holding a warm loaf of bread, you check for a pulse with 2 fingers on the brachial artery. Nothing. You start infant CPR with 2 thumbs on a sternum, the width of a credit card. You bag the baby with a mask that covers its entire face. Your partner is drawing up epinephrine in a dose so small, you need a tuberculin syringe to measure it. 1/4 milligram could kill this baby. 1/10 milligram might save it. The math has to be perfect. Your hands have to be perfect. At midnight, on no sleep, while a mother screams behind you in a language you don't speak, nobody calls to tell you what happened, you hand the baby to the ER team, and you never hear the ending. You drive back to base. You write your report. You stare at the wall. Your partner asks if you're okay. You say, yeah, you're not. You won't be for a while, maybe ever. Here's what they don't teach you in paramedic school. They teach you the medicine. They don't teach you how to carry it home. The suicide. You walk into a garage and a man is hanging from a rafter with an extension cord. His family is in the kitchen. His 12-year-old son found him. The boy is standing in the doorway staring at you like you can fix this. You can't. The man has been dead for hours. You make the call. There's nothing to resuscitate. You tell the family. The wife falls. The son doesn't move. He just stands there. You'll see that boy's face for the rest of your life. Every time you close your eyes, every time a room gets too quiet. The frequent flyer, Mildred, 87. She calls 911 3 times a week. Chest pain, shortness of breath, dizziness. Every time you show up, there's nothing medically wrong. She's lonely. Her husband died 2 years ago. Her kids don't visit. You're the only people who come to her house. You take her vitals, hold her hand, tell her she's going to be fine. You transport her because you have to. She calls again on Thursday. You go again because that's the job. Sometimes the emergency isn't medical. Sometimes the emergency is being human and having nobody left. The one you lost, the one that haunts you. Every paramedic has one. Maybe it was the kid in the car seat whose straps were done wrong. Maybe it was the 20-year-old who bled out from a stab wound while you were stuck in traffic 2 blocks away. Maybe it was the perfectly healthy 35-year-old who dropped dead from a brain aneurysm in a grocery store and you worked the code for 40 minutes and it wasn't enough. It's never the ones you save that keep you up at night. It's the one that got away. The one you replay in your head at 3 a.m. wondering, what if I'd been faster? You will carry that patient in your chest like a stone for the rest of your career. It gets heavier, not lighter. Myth: paramedics save everyone. Reality: the survival rate for out-of-hospital cardiac arrest in America is about 10%. That means 90% of the time when you do CPR, they die. You still do it every single time because that 10% is someone's mother, someone's husband, someone's kid, your body, the lifting. The average patient you're picking up off the floor at 3 a.m. weighs considerably more than you do. You're lifting a 250-pound person from a bathroom floor onto a stretcher, down a narrow hallway, around a corner, downstairs that were built in 1940. Two of you. No lift assist, no mechanical device, just your back, your legs, and a prayer. Paramedics have one of the highest injury rates of any occupation in America. By year 5, your back makes sounds that concern your chiropractor. By year 10, you're on first-name terms with an orthopedic surgeon. Your sleep. What sleep? You work nights, rotating shifts. Your circadian rhythm is a hostage situation. You sleep in a recliner at the base station, in full uniform, boots on, radio on your chest, dreaming about intubating someone. Your mind. 37% of EMTs and paramedics have contemplated suicide. Over a third. The proportion of deaths attributed to suicide among EMS workers is 5.2%, more than double the general population rate of 2.2%. 60% of EMS providers report burnout, 15% screen positive for PTSD, 15% for depression, 27% for general psychological distress. You don't talk about it. The culture says you're supposed to be tough. You're a medic. You handle emergencies. You don't have emergencies. Except you do. They're just invisible. They happen at 2 a.m. in your bedroom when you can't sleep. They happen at a family dinner when your kid drops a plate and the crash makes you jump out of your chair. They happen on a random Tuesday when you hear a siren and your throat closes and you don't know why. EMS providers are 1.39 times more likely to die by suicide than the general public. The toughest paramedics, some of them are drowning in silence. And the system has no idea. $58,410, that's the median paramedic salary in America. For the EMT basics, $41,340. $20 an hour. $20 an hour to make life or death decisions, lift people who outweigh you, get punched by drunks, exposed to hepatitis and HIV, and watch children die. The lowest 10% of EMTs make under $31,000 a year. In what universe does a person who holds a dying infant make $31,000? In this one. In America. In the richest country in the history of the world. Private ambulance companies, you're a revenue unit. Each transport generates a bill. More calls, more money for the company, not for you. Your ambulance has 200,000 miles on it. The stretcher sticks, the monitor glitches, but the company just bought the CEO a new office. Priorities. You work a second job. Of course you do. You're a paramedic by day and a DoorDash driver by night because one job that requires you to save human lives doesn't pay enough to live a human life. The violence. 69% of EMS workers reported experiencing violence directed at them in the past 12 months. Not over a career. In 1 year. You walk into houses where people are on meth, on PCP, on bath salts. They swing at you, they spit at you, they bite you. One medic gets a needle stick from a patient with hepatitis C and spends the next 6 months getting tested, waiting, wondering. The scenes. You see things no human was designed to process. Industrial accidents, farm accidents, electrocutions, drownings where the child is the same age as yours. You walk through those scenes in a professional trance doing your job. And then 3 weeks later, you're standing in a grocery store and your hands are shaking and you don't know why. EMS is the neglected stepchild of American healthcare. It exists in a gray zone between public safety and healthcare, funded poorly by both. Some towns in America have a 45-minute ambulance response time because there aren't enough medics to staff the trucks. You could have a heart attack in the richest country on earth and die waiting for an ambulance that doesn't exist because nobody wants to fund EMS. Your partner leaves. They always leave. The average career length for an EMS provider is about 5 years. That's not a career, that's a trauma tour. People get in, get broken, and get out. You watch your partners cycle through like patients on a stretcher. New face, same haunted eyes, same exit in 2 years. So why do you stay? Because at 2 a.m. on a frozen highway, you pull a woman from a car that's about to catch fire, and she looks at you with eyes that say, "I thought I was going to die in there." And you say, "Not tonight." And you mean it. And she lives because of you. Not a machine, not a hospital, you. 2 hands, a bag of drugs, and the training to know what to do. Because the old man in cardiac arrest whose heart you shocked back into rhythm, his granddaughter sends you a letter. She's 7. It's written in crayon. It says, "Thank you for saving my papa." You fold that letter and put it in your wallet. It's been there for 3 years. The edges are worn soft. You look at it on the bad days. Because your partner doesn't need to speak for you to know what they're thinking, you move together like one organism. They hand you the right drug before you ask. You've seen the worst of humanity together, and neither of you flinched. Because every once in a while, on a call that should have ended badly, it doesn't. The baby breathes, the teenager wakes up, the heart starts again. And in that moment, standing on the side of a highway at 4 a.m., you feel something that no paycheck can give you. You feel like you matter. Like all of it, the sleepless nights, the bad pay, the broken back, the nightmares. All of it was worth it for this one moment where you held death in your hands and said, "No, not this one, not today." Myth. Paramedics are just ambulance drivers. Reality. Paramedics are the most underpaid, overworked, and underappreciated medical professionals in America. They make hospital-level decisions in a moving truck on a dark highway with no backup and no margin for error, and they do it for $28 an hour. The next time an ambulance screams past you and you don't pull over fast enough, there are 2 people in that truck who haven't eaten in 9 hours, who are running on caffeine and muscle memory, who are on their way to the worst moment of someone's life. They make less than a plumber. A third of them have thought about ending their own lives, and they're still going because you called 911 and somebody has to answer. Your paramedic knelt in a stranger's blood tonight for $28 an hour with 6 minutes to figure out if someone lives or dies. Hired to the end. In the next episode, you're a 911 dispatcher, not the voice on the phone, the one who hears the gunshot, the scream, the silence. You can't see the scene. You can't touch the patient. You can't run in and help. All you have is a headset and a voice. And you have to keep them alive until someone gets there. Sometimes no one gets there in time. And you heard the whole thing. History is pain. Learn the truth. Subscribe to Hired to the End. Unit is clear. Back in service. See you next shift.